So thank you very much for having me today. I just wanted to say that I am a general practitioner right now, and I do internal medicine as well. I've been an internist for over 20 years. So what is hyperbaric medicine? Hyperbaric oxygen therapy is the use, in general, the use of oxygen under pressure as a drug. So we're going to talk about it a lot as if we're using a drug. And this is the chamber that I have in my office. It's very, very small. ACVIM is the company that, I have to thank them, because if it wasn't for them, I think all these articles and all this current awareness of how great hyperbaric oxygen is wouldn't happen. So there's a company that's decided to champion this effort. They're not making a fortune from this. They believe in it. And so I just want to say that without that kind of effort, we wouldn't be able to do any of this. I do pay for every time I turn on my machine, so I'm not making money by saying this, but I'm just happy that we have this resource available to us now that makes it pretty easy to use. So exact standards as a human chamber, we can look inside through the portals. It's a little different design today. You'll see it down in the exhibit hall. This thingy pulls out, so if you have a big dog, you can lift them up and put them in. This is a screen that shows what's going on inside, 3 different cameras, and these are the controls. And it fits in a really tiny space in my office. My office is only 2,000 square feet, and we have it where our washer and dryer are, so it's pretty small. And we use dewars. They're very tall oxygen containers. They don't cost very much. They're very efficient, and they take up very little space. So for anyone who says they don't have enough space, if you really want it, you can work it out. These are some of our happy patients inside the chamber. They do very, very well inside the chamber. All right, so let's talk about how it works. We're going to deliver 100% oxygen under pressure. What does that do? It dissolves oxygen in your plasma and delivers tons and tons of oxygen everywhere where you don't even need red blood cells. It's going in the plasma, it's dissolving, and it's getting where blood can't, and obviously where blood can too. So we're getting oxygen delivered much more to our tissues and bodies. I'm not going to dwell on this, but you probably cringe when you see the word physics. I know I do. But these are the laws of physics really help us understand why it works. And so as Boyle's law tells us, as the pressure of a gas increases, the volume is going to decrease. And Dalton tells us that if we add up all the different gas elements, their partial pressures will equal the total 760 millimeters of mercury that we're at right now, or atmospheric pressure. So today we're breathing 21% oxygen, we're breathing 78% nitrogen, and a little bit of a few other gases. And then 160 millimeters of mercury is from oxygen, and the other 590 from nitrogen and other gases. Graham tells us that gases go from a higher concentration to a lower concentration, which helps us understand how oxygen freely flows into the tissues and how the other gases flow out. And Henry's law tells us about the solubility of gas under pressure, sort of like the Coke bottle, right? So you get a CO2 canister, you put it into the bottle under pressure, and the bubbles dissolve miraculously because of the pressure into the bottle. Close the bottle. Once you open the bottle, remember, if you open the bottle really fast of your club soda, what happens? Giant bubbles, it spills all over you, right? If you open it up really slowly, as if you're decompressing slowly or coming back up from a deep pressure slowly, the bubbles are really small and they don't burst. So that's just something I want you to think about as we go forward. So this is really the meat and potatoes, okay? The effects of the increased pressure. So oxygen is going to have a lot of its own beneficial effects, and increased pressure has a lot of beneficial effects. So if we just talked about pressure, we're also going to talk about it. Well, you'll see. So gas goes into solution because of Henry's law. Bubbles shrink because of Boyle's law. And Graham's law is creating this great diffusion gradient. So at room air, which is 21% oxygen, if we were to breathe room air, hopefully our arterial oxygen tension is going to be close to 100. Our approximate tissue oxygen tension is going to be about 55 millimeters of mercury. And we're going to deliver oxygen at 3 mils per liter that we breathe. And at 3 ATA, or 66 feet of water, oxygen in the environment is 100%. So now we're delivering an arterial oxygen tension of about 2,000 millimeters of mercury. Our tissue oxygen tension has the potential to reach 500 millimeters of mercury. And now we're delivering 60 mils per liter to our body of oxygen. So at 3 ATA, which is a little high for what we would normally treat, but it just drives home the point, we get 20 times more oxygen in the plasma and up to 5 times more oxygen in tissues. It's so incredible that a gentleman named Dr. Burma was one of the first people to really pioneer hyperbaric oxygen, and he did a study where he exsanguinated pigs, and he took out all the red cells, just put back the plasma, pressurized them, and they were able to live for hours and hours without hemoglobin. So that study's called Life Without Blood. And so that's the power of dissolved oxygen. You don't necessarily need the hemoglobin. So what else does it do? We're also delivering oxygen, and oxygen in high amounts also has tremendous effects. So we are, by increasing pressure, we're allowing tissues to overlap a little bit more, and we're delivering more oxygen. So we're decreasing the diffusion gradient for oxygen, so we're making it oxygen dense even more so. We're also, what you need to know is that the effects of this last for quite a long time. So even oxygen tensions, even though the oxygen therapy is over, will last about 4 hours in your system, and the effects of it will last even longer. And one of the most important things that oxygen is doing in hyperbaric medicine is causing vasoconstriction. And that's one of its ways to reduce edema. It might sound counterintuitive. Why would we want to vasoconstrict? But it doesn't matter if you vasoconstrict if you don't need your blood vessels anymore, right? Because you still have all that plasma. So you're going to vasoconstrict all smooth muscles. That's all arterial and venous smooth muscles. But the capillaries and the lymphatics stay fine. So they're still able to do their job. They're still able to reabsorb fluid and circulate and take away bad stuff, but bleeding and large amount of oozing is not going to happen as much, and that means that swelling and edema are going to reduce as well. And the most profound vasoconstriction, research has found, happens in the brain, the retina, and the skeletal muscle. So what we just talked about is the decreased filtration of fluid from the capillary to the extracellular space due to vasoconstriction, and then reabsorbing all that fluid at the capillary level into the lymphatics. And so that's going to help clean up a lot of excess fluid that's there in spaces without allowing more fluid to build up. And then we're also, by doing that, decreasing, as we said earlier, capillary diffusion distances. And again, now we are, again, with our common theme, decreasing edema causes less injury, less of that vicious cycle of vascular compromise, bacterial translocation, necrosis, pain, and swelling. So this is a really good example. Now, this is kind of like, the reason I did this, first of all, I think it's a really profound example, but I want you to understand that if hyperbaric oxygen did nothing other than remove edema, you would still want to have it. And here's why. This is Joe Boxer. Yes, I'm an internal medicine specialist, and yes, I debrided his pancreas at surgery, and yes, I was scared to death. So I gave him a plasma transfusion after doing that, thinking that I would help prevent him from having more severe pancreatitis. And this is what happened. He had an allergic reaction to his plasma transfusion. I panicked because I'm not going to put him on steroids. And I said, oh, wait a second, I have a hyperbaric oxygen chamber. And 1 hour, and this is honest to God truth, 1 hour after hyperbarics, after his little reaction, he's almost perfect now. And this just gives you the profound example of edema reduction if it did nothing else. Reduced his edema. And if you can imagine what it can do in Joe's face, so you could see this very easily. But you know, a lot of times we give medicine, we don't see what's happening. We hope we know what's happening. We believe what we read and we believe the literature, but we don't get to see it. Well, this is a good example of what you may not see, but is still happening. All right? And these are all the different kinds of diseases that they're in green. I know it's really wordy and I apologize, but just think if it only helped head trauma and cerebral edema, if it only helped for snake envenomation, just to reduce the swelling. It helps in so many different aspects if we only reduced inflammation, edema. But it has greater effects than that. It's a floor wax and a dessert topping. No, it has effects on leukocyte activity. I promised I wouldn't go into detail on these. All this detail is in your notes. I wish I had 2 hours, but I don't. But I want you to understand that there is good science behind why it affects leukocyte activity. It will decrease inflammation and increase bactericidal capabilities, all through cytokine inductions and blocking cytokine induction. It improves phagocytosis that hypoxia doesn't allow. It allows macrophages to do their job in light of necrosis and lack of oxygen. It brings in oxygen and lets the macrophages do what they would have wanted to do without it. So all these details are in your notes. Bacteriostatic and bactericidal effects are so dramatic that sometimes you don't need antibiotics, but if you have both, isn't that great? And it will actually enhance or work synergistically with other antibiotics. And in humans, it's used particularly for clostridial diseases. There's a gentleman in the audience, I hope you don't mind, who had a diffuse systemic clostridial disease. He was about to lose his arm. He was about to die. And at the last minute, he was prepped for surgery. They said, let's try one thing. They put him in the hyperbaric chamber, and he's alive here today in our audience and has now built his own chamber in Mexico to treat patients because he saw the effect on himself. So thank you for sharing and letting me share. But it is pretty dramatic. And if it can kill the organism, it's going to stop toxin production. It actually also attenuates the toxin. And it's magic, no, but it really does work extremely well and can be helpful in combination with other therapies. So I'm never going to tell you to use this by itself. I'm never going to tell you not to debride a wound. But if you use it in conjunction with this, you're going to have really dramatic results. And again, people with diabetes, that they don't lose limbs now because they can save it and stop infection and improve the vascular integrity of their limbs. So again, reduction of infection. All these organisms are sensitive. I heard a lecture earlier about Pseudomonas and about staph species and methicillin resistance. This will help. So even if there's an antibiotic that may not be 100% effective, but may be intermediate, or even potentially without a susceptible antibiotic, this will help. I have Lyme on here as well. The organism can't live, Lyme organism can't live in high levels of oxygen. So if we had an acute Lyme disease, it will kill the organism. It's not going to necessarily reverse all the chronic damage, but it will help. It also works very well as an antifungal. I'm not recommending it's only used for a fungal granuloma, but if we have fungal disease and we have swelling, we have necrosis associated with it, altogether will help the entire scenario. And it will also help with some of the antifungal medications. Again, we talked a little bit about how it increases the efficacy of some antibiotics. Some antibiotics don't do as well, some do much better. And some actually have decreased efficacy while they're under pressure, and then it comes back up and is not a problem. It also, as you can imagine, now we're talking about use in many different aspects, but a lot of its use in emergency medicine is for severe trauma. If we want to use this for animals that have blood clots, for systemic emboli, we're worried about free radical damage upon reperfusion. And it actually decreases free radical damage. It's going to have really remarkable effects. Again, all of this is in your notes, but I want to get to some good examples for you. So here's an example of a dog that was found in the driveway. It lived in the driveway. I have no good history on it other than it had a large wound and he wouldn't let the owners touch him. He was vicious. He was in excruciating pain. I actually went to their house. I don't do house calls, but I felt bad. And I went to their house and I took this dog over to my office, and it bit every single person in my practice. It was in excruciating pain. It was very sad. But the dog had necrotizing fasciitis. And this is just massively swollen, black tissue, very hard to determine edges of anything. It's very hard to tell what's going on. And we all know that in this type of situation, it's life and death. It can ravage their body and they can die very quickly from sepsis. So luckily we had a hyperbaric chamber. Now this is a little bit exaggerated. Well, not really exaggerated, but it's not exact science pictures, but this was the first day, and I just wanted to emphasize how there was just how the amount of edema reduced in 2 treatments and between day 1 and day 2. So you can actually see a waist here, you can see some shape, and you can also define now where the lesions are on this animal. This is the day before, you couldn't see this, right? So the disease happens underneath the skin and ravages. But what hyperbaric oxygen did was stop the infection in its tracks. It decreased the inflammation so quickly that more damage wasn't able to happen. And now we have really well delineated areas that are necrotic and that we're going to have to deal with. And so we were able to begin to really address the wounds, whereas I think otherwise would have taken several more days and a lot more intensive care to help get to where we needed to get. On day 3, we were able to, the edema had reduced so much and the dog was doing much, much better. Infection was under control, fever was gone, he felt significantly better, and we were able to then, but after 3 days, you know, that's pretty, I think it's pretty impressive. So again, how is that working? It's helping to improve tissue repair and tissue proteolysis. It's enhancing fibroblast proliferation, enhancing production of collagen. Collagen is also laying down matrix for other osteoblasts and osteoclasts and fibroblasts to do their job. And so all of these things are going to help speed tissue repair. And also the collagen matrix is going to allow you to then produce, have a basis for new blood vessels to grow in and for things to repair. So we don't just have increased angiogenesis, which is new blood vessels budding from existing blood vessels, but we have increased vasculogenesis, which is bone marrow-derived endothelial precursor cells. You know, this whole week we've been talking about stem cells, and to me it's pretty remarkable. I think that there's so much in common with how descriptions of how stem cells work today and hyperbaric oxygen. We'll talk about that some more too. But it's been found that oxygen, it induces neovascularization, and that usually takes about 14 treatments or 2 weeks to see the effects, but it will absolutely increase vasculogenesis and angiogenesis. So it's pretty exciting. And again, one of the most profound things I think that we'll see in the future as well is that it mobilizes stem cells. So it's a natural way for the body's stem cell count to increase, and this has been proven. There's some very good articles, some of which I have with me if you're interested, that a single 2-hour treatment will double your circulating CD34 stem cells. And that's just measuring one type of stem cell. At approximately 40 hours of hyperbaric oxygen, the circulating CD34 cells will increase 8 times. So 40 hours at 2 hours a day is not very long to have 8 times your inherent stem cell production increase. So imagine how we might be able to utilize that. If we can increase stem cell production, maybe we can use hyperbaric oxygen before harvesting to do something else. And all of the things that we're talking about, the regenerative capabilities, the neovascularization, the immune modulating properties, they're all very similar to what people are describing this week, particularly on stem cells. I think it's really exciting. All right, so another long list of things that we could potentially utilize this for. We're not going to talk about emergency medicine. We'll be talking about that at IVEX soon. And hopefully a manuscript will come out by me soon with lots of reviews. But there's so many potential applications. It's not meant to be used by itself, obviously. It's meant to be utilized in tandem with other treatments. So I just want to talk particularly about internal medicine issues. We'll do some neuro as well, but ileus, we talked about that. We talk about pancreatitis. That's one I think you're probably all familiar with, using it for pancreatitis. So what happens in pancreatitis? Severe swelling of the pancreas, edema, release of toxins that are locally toxic. We see dramatic reduction in pancreatic inflammation with hyperbarics. I tried to do an ultrasound comparison, and I can't appreciate a difference in how it looks from one day to the next on ultrasound, but I can tell you that my patients feel significantly better. They eat sooner, they tolerate their therapy, and they all go home sooner. This particular dog, Ali, is one of my favorite patients. He has really very severe heart disease. I couldn't push fluids in him. I did give him plasma, and I gave him as much fluid as he was able to tolerate, and I treated him with hyperbaric oxygen. He had severe necrotizing pancreatitis with fluid in his belly, the whole 9, and he did really, really, really well. And we've treated several since then. So don't forget that I'm in private practice, so I'm not in a referral center where I'm getting 20 pancreatitis cases referred to me a week. I'm treating what I'm allowed to treat as it comes to me. But we still have a lot of great ways of doing it. In humans, there are several papers on treating inflammatory bowel disease and refractory animals. I did try a very severe protein-losing enteropathy dog. I think if it's congenital or there's certain things that we can't control, we're not going to make those dogs better. But if it's an acute problem or even with chronic inflammatory changes, we will help that jumpstart, even if we do use it in conjunction with other treatments. Bloat or GI obstruction, we touched on. Peritonitis, you know, they do horrible studies in mice where like they talked about earlier in the stem cells, where they inject bacteria, they induce peritonitis from a cecal rupture. Well, we didn't do it on purpose, but we've had dogs that came in with peritonitis, and we found that they did phenomenally well. Their sepsis resolved quickly, they become comfortable quickly, and they heal. Maybe they would have healed without it, but I really, truly believe they healed significantly better and more quickly as a result. Duodenal ulceration, all of these things. Hepatic inflammatory disease and hepatic necrosis, I've seen it get better. We had a dog that had a fungal granuloma that had exceedingly high liver enzymes. A biopsy of the liver confirmed hepatic necrosis. We treated it to help it preoperatively to take this granuloma out, and we found that the liver enzymes normalized within 2 weeks. I think even less. Was it a week? No, 10 days. Okay, I'll take 10. And feeling much, much, much better. So did I rebiopsy after that? No, but I could see, on ultrasound, I could see clinically that the dog was significantly better. And imagine if we just are decreasing edema in the liver. And we also I've also used it for biliary tract dogs, kitty cats with severe cholangiohepatitis that are very yellow and miserable. They do significantly better. We're decreasing the inflammation, we're decreasing inflammatory cytokines, we're improving our antibiotics function. And so all of these are things that we could think about utilizing. I'm not saying buy a chamber tomorrow and utilize it for this. I'm saying let's get together and let's really do some really well thought out, organized studies so we can come back next year and say, here's what we did and here's how we can tell you that it works. I'm telling you from my experience. So again, I'm not a surgeon, I'm an internist, and maybe you surgeons will say I'm just a big wuss, but I did a string foreign body. I was very concerned about the integrity of the tissue here, and I thought to myself, I'm just worried that there's more bruising and more disease, maybe some that I can't even tell. So I did use it post-operatively for this problem. Similarly to a bloat or something else, you can restore oxygen flow and help improve the integrity of the tissue by decreasing the edema. And utilizing it in humans, there are many papers on nephrotic syndrome and reducing protein in the urine or protein-losing nephropathies in conjunction with treating for underlying disease. The same fungal granuloma dog we had came in with a 33 protein creatinine ratio. Very, very scary. He had a giant fungal granuloma, had hepatic necrosis, had a lot of things going on. But had surgery 2 weeks after we started hyperbaric therapy. We removed, the big fungal granuloma was removed, not by me, don't worry. And another 10 or 12 days of hyperbaric oxygen, and the protein creatinine ratio came down to 22 prior to surgery, and then 7. Now maybe it came down strictly because we removed the mass, but I think it's very promising, and that's something that we really need to look into in the future and see if that's real and if we can repeat that for other animals. And again, it all depends on what it happened from, right? If we decrease inflammation in the body and we decrease inflammation in the glomerulus, we also have to increase what caused that inflammation, decrease what caused that inflammation, but we can enhance healing and help perpetuate that. Inflammatory and infectious diseases, all for the same reasons. For all of my neurology friends in the audience, GME, Dr. Lyman, I'm sure you've all heard his name ad nauseum, but he's wonderful and he's really made it so that we have hyperbarics on the top of our mind, whether we like it or not. And he actually has a dog with GME that's been controlled strictly by using hyperbaric oxygen. Now granted, he's had to do it chronically, so it may not be particularly practical, but for acute severe problems, we do see them do significantly better right away. And so that just, in and of itself, is going to help improve their quality of life and help us get these diseases under control more quickly. Vasculitis does extremely well. Severe immune-mediated polyarthropathies, I've used it for. Lyme disease vasculitis, I'm assuming it was from Lyme disease. It was from Lyme disease, and did significantly well with just a few treatments initially of hyperbaric oxygen, made the lameness and swelling go down in the leg. All of osteomyelitis in people for bone infections that, diabetics get such severe chronic bone infections, and the only thing that helps them ultimately get better is antibiotics don't work anymore by themselves, so they really need to use that hyperbaric oxygen to drive that oxygen into those tissues. And so this was Sammy. He came in with acute onset of foreign limb paresis the night before. His blood pressure was over 260, and he had petechial hemorrhages in his retina. I treated him with amlodipine, and an hour later, we put him in the chamber. He promised me.
Here she goes. Where are you going, Sammy? Sammy!
All right. All right, well, you can see that he's circling right. He has no CP in the right.
Samantha.
Honey.
Sammy.
Sammy.
Hi, Sammy. Hi. You good girl. Hey.
It slips under her.
Honey.
I know, it's a little long, but I really wanted to show you
It's okay.
that he really could not step on that right front leg, okay? So he went in the chamber. This was after his first treatment, immediately after.
Hey, Sammy. Yeah, what are you doing?
Listen to this.
Yeah, she is.
I love this chamber.
I love this chamber.
Can you bring her back tomorrow?
Yeah.
So they said, I love this chamber. It works. Can you come back tomorrow? So that was just after one dose. You could see that he did significantly improve, just a little bit. And then the weekend went, that was Saturday. Monday they came back. And he was doing much better already over the weekend. And this is him on Monday. I'm not sure if this was before or after his last treatment. He was already doing significantly better. He was jumping and back to being normal. All right, this is a really dramatic example of a dog. This dog went to a neurologist. I saw it the night before. It was in pain. It had Lyme, so I thought, well, it didn't have CP deficits the night before. The next day it came in and it was paralyzed in the hind limbs. I sent it to our local neurologist for a workup. It was Friday afternoon. I'm not sure exactly what happened, but she decided that because Bonnie had a really bad heart murmur and was 15 years old, that she wasn't a good surgical candidate, and she sent her home with the home euthanasia vet's phone number, even though she knew I had a chamber. So
Ambulatory.
this is
No
Bonnie.
feeling in her own legs. She's unable to stand
Can you
today.
hear it?
She has decreased proprioception, the right hind, although she does have motor today.
Can you hear it?
Decreased in bone.
As you can tell, she is putting a little more weight.
All right,
She's
so
not doing it all by
Yenny's saying
herself.
that she's
She's
trying to put
push
weight.
down
So
and
after
sit.
4 treatments, she got better very quickly. Treatment 6, probably 5 days. Forgive the neuro exam.
She's walking now. She's urinating on her own. She can stand.
Yeah, this is treatment 10. Come, Bonnie, come here. Come here.
She was paralyzed. She couldn't walk. She had no deep pain the first day.
Wow.
And that's my
15
reception.
treatments
Wow.
of hyperbarics, and as you can see, she's trying to go for the cast
This
food,
is about,
but she has
right now we're probably at
function
day
of her
10.
back legs. Dad says that her right hind is catching up to her left hind now, with ability of running.
Yes. Yeah,
This
absolutely.
is Bonnie Daly's last treatment.
So
This
nothing's
is her
meant to
before
be
her
magic
last
on its own.
Final treatment of 20 treatments. She was better after only 5 or 6, but has progressively gotten better with additional treatments.
And she went on to do very, very well. Here's a really great case, post-radiation therapy. So radiation therapy does a lot of nasty things, and where's my cheat sheet? Okay, so radiation therapy in itself, this is a dog that underwent electronic brachytherapy. How many of you have heard of that? So it's a local beam of radiation that it's experimental that a veterinarian on Long Island was doing. And the good news is the tumor went away. And I'm sure it's going to be a positive result in a study. The bad news is this is what was left for 5 months. This dog had a non-healing, horrible radiation burn, and it wasn't going to heal. Because what happens with radiation is fibrosis of the tissue and arteritis. The blood vessels aren't going to grow back in there. They can't grow past this dead fibrous scar tissue. So epithelialization is not going to readily occur in here. It ends up with poor vascularity and severely hypoxic tissue, necrosis and ulceration. So they came to me, sadly, 5 months later, and the lipoma had not come back. That was an infiltrative lipoma that was being treated. So days 10 through 18, I'm not a surgeon. I'm an internist. I want to help them, so I did my best initially in debriding the wound and trying to do what I could, but this dog was having hyperbaric oxygen once a day, almost every day, and then eventually became every other day. In people with wounds, that it's ideal to do hyperbaric oxygen at least once a day for 20 treatments minimally, and then sometimes as much as 72 or even more treatments as needed. In Barron, we did daily wound management. We cultured the wound. We made sure everything was healthy at all times. We always used sterile procedure, but this is a gigantic wound. And we knew that without hyperbaric oxygen, we were going to have a big challenge on the edges of those wounds. You could see how we were able to then close it significantly. Things were going really well. So day 18 was the 9th treatment. A lot of times I like to close wounds, but you don't necessarily have to close it. I wish I had an example with me where animals that have burns will have their entire back end of them. I have another veterinarian who showed me pictures yesterday of using a chamber and a puppy that was burned, no skin, no hair. And within weeks and then a few months, the hair was entirely covering the dog again, because we're enhancing all of these things that we've talked about, and stem cell production and revascularization and epithelialization and all of those things that hyperbaric oxygen is helping. So I didn't have to necessarily close this, but I wanted to close it because they were moving North Carolina and wanted this fixed. So we added moisture because don't forget, you can't do this without medical management, without really managing it. A dry piece of skin that's not managed effectively isn't going to heal, whether we use hyperbarics or not. So we were very careful in our wound management as well. Day 25, 13 treatments followed, and daily bandage changes were able to close it even more. So we have more elasticity to the skin. We have fresh edges now. We have blood vessels coming to the edges where they were not able to come before, and really nice, healthy granulation tissue. Again, hair also grows like crazy. Some of you might want to just try that. But really, the hair grows very, very quickly. And this dog had, and this is a what is he, a husky? Had to be shaved all the time because the hair just kept getting in the way. But you can see now our wound is much, much smaller. And we had this one little divot in here. It was a deep pocket, so we're trying to redirect more moisture there. And this is day 46, treatment 20. We decided that we were going to try to close this. I had a surgeon help me. We did a flap, a skin flap, transposition flap. And this triangle is where we took the healthy tissue from, so that's what's left of the gap. And then they flapped it over to cover this defect here. And remember, there's a big hole under here, so that part is really not touching other tissue that we would like it to. But still, now we're dealing with transposition graft and radiation wound healing, chronic tissue damage. So over the next few days, this superficial tip of the graft, it's actually really tiny, didn't take, and probably because of the skin underneath it. But one of the uses in humans is for graft acceptance and grafting. So it is extremely effective for that. And you can see that the rest of it took beautifully. And then the healthy skin is healing really nice, and it's getting smaller every day. It's a little hard to tell here. And we cultured this, by the way, multiple times. There's never infection when we're using the chamber. It's just pretty remarkable. The reason we do it, though, is if infection happens, we want to be prepared, right? Because then we may not be able to, we want to be aggressively prepared. So interestingly, when we started to debride this, what looked to me to be completely not taken tissue or unhealthy tissue, underneath was actually really healthy granulation. So it was really, really cool. But there was no help for this because even though it was coming in this way, there was still a hole underneath there, so it wasn't going to attach as well as we would like. But it just shows you how nicely we're getting healing and neovascularization. So there's that hole, that pesky hole, but eventually it did. We have a little bit of a pressure suture on here to try to bring the edges together, but it did beautifully. And so this is day 32 and treatment 32, 76 days. So don't forget, this is a guy who has a job and a family. He can't just drop this dog off every day, and he's not going to leave it with us because it's his best buddy. So we did what we could in that instance. Oh my gosh. So here's how he did. He did fabulously well. Dermatology, we have a lot of uses in dermatology. We talked a lot about it already. Getting oxygen to the skin to deep pyodermas and MRSA infections, immune-mediated skin disease and vasculitis, beautiful for hair regrowth, and it decreases inflammation and otitis as well. just a quick example of a dog with really severe skin disease, had yeast infection, had other things going on, treated with antibiotics and bacterial infection. I was taking care of it for a month, so I said, let me just see what happens if I put her in the chamber every day and what happens. And in 17 days and 14 treatments later, you could see how much better the lichenification is reduced. Her hair is growing back dramatically, and the infection is gone. She's not biting and itching anymore. She's also being treated medically. Oncology. I wish I didn't have the experience that I've had in oncology, but in humans, pre-radiation therapy, they'll use hyperbaric oxygen to sensitize the tissue. Post-radiation therapy, they'll use it as well for osteoradionecrosis lesions. And unfortunately, one of the other reasons we can use hyperbaric oxygen is adriamycin toxicity. These are pictures of people who had extravasation of adriamycin. It's really disgusting. This is the man's chest. He had a port in his chest, can only imagine what the underside looks like, and this is an example of an arm. So imagine what happens in our patients. Hopefully you haven't seen it very often, but my dear friend and colleague who sits with us today, his dog, Ein, had lymphoma, and silly man entrusted me to his care, and we gave adriamycin, and we watched it go in really carefully in those little corgi legs, and what we didn't notice is it wasn't going in, it was going around. And fortunately, we had the antidote, which is called, I can't pronounce it, or Zenocard, used at the appropriate dosages. Perhaps maybe it didn't go completely into the other vein that we tried to put it in, or maybe a little bit went in, I'm not really sure, but Ein definitely started to show us symptoms within about a week of the extravasation that seemed better, but really got much more severe over the next 30 days. And I was in denial, and maybe we were all in a little denial. I didn't want to shave it too much, even though I really should have shaved it more, but I was afraid that we would see what we've done. But what happened here is actually just severe induration. It was hard as a rock, extremely painful, very, very swollen, oozing, and disgusting and infected. And all the way up into his armpit. You know, his leg's only this big, so it's, you know, hard to, that's a joke, but anyway. All right, so here's day one. To compare to the next few days, and it's a little hard to tell. We did get up the nerve to shave some more. We did, you know, clean it and put antiseptic on the leg and kept it wrapped as best we could. But 6 treatments later, 11 treatments later, we're starting to see the inflammation come down significantly. He's much, much less painful. There is no medicine for this. The only treatment at this point is pain relief, antibiotics, and hyperbaric oxygen. And this is what would be done in a person as well. Again, treatment 17, treatment 25, you can start to see a little bit of a waste here. These are very amateur pictures, I apologize, but it's what I left my technicians to do while we do other things. See how fast the hair is growing back? Day 24 and day 25. So what was interesting is if you look here, Ein will never let you touch his toes. He's the sweetest dog, but you cannot clip his nails. So what was happening was he had nerve entrapment, and he was sloughing his toenails from dragging his foot. So he had nerve entrapment from all of this. Basically what's a compartment syndrome, right? Such massive swelling that the nerves and everything inside are so compressed because there's nowhere for them to go. So the muscle dies, the nerves die, and then there just becomes a more vicious cycle of inflammation, which was halted and reversed with hyperbaric oxygen. Thank God we had a hyperbaric oxygen chamber. Ein wouldn't have his leg, and then Rhett would not be sitting here. So the knuckling stopped, and this is some induration that was still in the armpit. This is with his leg out. To this day, still a tiny bit indurated, but he's perfectly comfortable, perfectly happy. He's not knuckling anymore, and he's normal. So to me, this is one of my most miraculous cases. I'm sorry it happened, but I'm glad that we're able to use it as an example. And something else to tell you is that he's still in remission. So people say, well, what about lymphoma with cancer? At this point, I'm still in remission, even after having a month of hyperbaric oxygen treatment 2 days a week. So hopefully it didn't make his cancer worse. So here's the real moral of the story, though. All right, so what do we do, our treatment protocol? How over am I? Am I like mega over time? Okay, so I'll just go really quickly. I'm sorry. Thank you for staying. I'm sorry that I'm going over. But this is a drug, so it can have toxic side effects. So we have to be really careful how we do it and what we do. And there's really no good published data that tells you what to do in an animal. So those are the things that we're going to work on. But we extrapolate from the human. Certain emergencies, It's really best for your most acute, the most acute problems are going to be best treated quickly with hyperbaric oxygen. The more chronic problems are going to take a lot longer to see results. If you want neovascularization, if you want to see that, you're going to need to do a minimum of 14 treatments. And then a month later, you're going to see those results. And actually, for the rest of the patient's life, you'll probably see those results. So different things happen for different periods of time. I'm going to go through this quickly because we can always talk about that. I'll be at the booth after this in the exhibit hall. Risks and side effects. Again, we talked a little bit about seizures. Real complications, you're not going to put an animal with a pneumothorax in a chamber. I think that's probably self-explanatory. Use of certain drugs are actually contraindicated because their effects will be exacerbated. When can you have poor outcomes? When there's decreased cardiac output. I'm going to definitely talk about that in 1 second. So one of the major contraindications is that we all want to use it for everything. And so we are like, this is a dog's last chance. It's got SARS. It's got vasculitis. There's nothing else I can do. I'm going to put it in a chamber. Well, if you do that, you need to understand that if the lymphatics system is overloaded, if there's nowhere for the fluid to go, if the urinary tract, if the kidneys are shut down and you're trying to make this animal better with hyperbaric oxygen, it's not going to get better because the fluid has to have a place to go. So if you're extremely overhydrated, if your heart is not working, if things are not circulating, you're going to have a serious problem. And where's the blood or the fluid going to go that's being squeezed out into tissues? It's going to take the path of least resistance. If it can't go into the urinary tract, it's going to come out in the lungs. So you really do need to be somewhat careful in who you pick and how you pick and why you pick. And it does increase the peripheral vascular resistance, and people with low cardiac outputs, ejection fraction of 35, I wouldn't go. I don't know how they're even walking, let alone getting put inside a chamber, but it happens. So they don't go in a chamber. And just remember, it's a drug. It's a drug that has its complications and its risks just like any other drug. And briefly, this is Hercules. He had a disc. He's a boxer. He's 7. Okay, I know he has cancer, but he had responded to prednisone for apparent disc problem in the past, which I guess is believable when you look at his x-rays. So we thought about it, and then we did x-rays as a screening test. And thank God for radiologists, because I personally could not live without my radiologist. It's hard to see, but there's a little bulla there. And so that may not have been a big deal, but it does make him at greater risk for going under pressure. Not for going under pressure, but remember, for coming up, if you open if you bring him up too quickly, that bulla can rupture. All right, so those are things that we may not find out. We've probably put animals in with bulla before, and when you're careful coming back up from pressure, you're probably okay, but that is definitely a risk, and I would not put him in there. And he did have a tumor. So just to conclude, there are really a lot of very exciting things that are happening with stem cells and hyperbaric oxygen. So this is just a really exciting study of a mouse heart. They induced myocardial infarction in the mouse. They gave hyperbaric oxygen only to a group of mice, and then they did the histopath and saw that it maybe did a little bit better. They did it with mesenchymal stem cells only, and then they did it with hyperbaric oxygen and mesenchymal stem cells, and the muscle healed significantly with the combination. They're also doing studies in people where they're harvesting mesenchymal stem cells, injecting them into the pancreatic artery, and combining that with hyperbaric oxygen and somewhat reversing the effects of reversing diabetes in animals. And even in veterinary patients, there's some preliminary work of using increasing the levels of stem cells in the body combined with hyperbaric oxygen, helping reduce diabetes symptoms and necessity for insulin, and even reversing it for periods of time in some animals. So I think that's really, really, really exciting stuff to look forward to. And I think, just to really hone it in, where we were before, everything was anecdotal. Where we are now, where some stuff is still anecdotal, but what we need are champions. We need people who are willing to help do the science behind it, to show, so that this room is packed next time with people that actually are going to see science behind it. I think it's there, and I hope that all of you will embrace the technology and come back and say, hey, you were right, it really works. Here, just in case you're wondering, in 15 months we treated, this is just some of the cases that I treated just in private practice. I have one other doctor with me. I'm not getting zillions of cases in my door, so there's very practical good uses even in a smaller private practice. So think what you can do in your referral centers. Thanks, guys.